Welcome to PCOM Perspectives, where we discuss news, events, research, and other topics impacting our campuses and communities. Join us as we share our PCOM perspectives. Hello, and thank you for joining us. I'm your host, Dr. Jay Feldstein, and today we're talking with two very special guests, Dr. Michelle Lent and Dr. Bob DiTomasso. Dr. Lent is an associate professor in the Department of Clinical Psychology. She received her PhD from Yeshiva University and completed her pre-doctoral internship and postdoctoral fellowship in behavioral medicine at Temple University Hospital and the Temple University Center for Obesity Research and Education. Dr. DiTomasso is a professor of psychology and director of institutional outcomes assessment. He has been at PCOM since 1995 and has served as vice chairman, Director of Clinical Research, Chairman of the Department of Psychology, and Dean of PCOM School of Professional and Applied Psychology. Today, we're discussing their efforts in creating the Journal of Integrated Primary Care, which we call the JIPC for short. An open access online journal, JIPC was spearheaded by both of my guests here today and is designed to highlight the work of PCOM's integrated primary care researchers as well as researchers around the world. Welcome, Dr. Lent and Dr. DiTomasso.
Thank you, Jay.
Great to be here.
And from now on, I'm going to refer to you as Bob and Michelle. So, Bob, congratulations on the first issue of the Journal of Integrated Primary Care, which came out last December. How did this initial idea for the JIPC come about?
Well, as I reflect back on this, the seed for JIPC is what we call the journal, was planted initially through my conversations with the late, great Art Freeman, who was my mentor and originally chair of the department. And how he got into this whole idea of integrated care was he met a researcher from PCOM, Gene Mochin, in an airport, who had a grant for interdisciplinary care being delivered and training at that time. So that's how this whole idea really started to percolate. Art recruited me and later other faculty to drive our programs in the direction of integrated care. I remember he had said to me, how would you like to teach people what you do and what you've been doing for 20 years? I had been the only psychologist in a family medicine, University of Pennsylvania affiliated residency program where I worked with 8 attendings and about 16 or 18 residents. The other thing is, I recall an early site visit probably 20-something years ago, maybe 25 years ago, where we were told by the site visitors that PCOM was in a unique and ideal position for what was coming in terms of the future of healthcare. And as you know, PCOM professes a holistic approach, which is by nature, by definition, integrated. And we saw how the field was moving toward integrated multidisciplinary team-based approaches, particularly within primary care, and the emphasis on behavioral health. And of course, this is our focus as psychologists. So in my discussions with Dr. Lent, who's a seasoned health psychologist, we started tossing this idea around. We were like, boy, it'd be really great if PCOM had its own journal where we could capture cutting edge research, contributed to best practices being developed. It'd be a great opportunity to highlight all the fantastic things that are being done at PCOM and as a means of expanding the evidence base. So that's how we got the idea. It's a long story, but somewhere in there, Michelle and I started thinking about this and we became very excited, brought it to cabinet as part of the strategic plan, and it got approved, and we're off and running and having fun.
That's great. Michelle, so what's the submission process look like? And are there any specific types of articles you all are seeking?
The submission process for JIPC mirrors what's typically done in peer-reviewed scientific journals. Authors can log in on the JIPC site. They can access information on how to format their manuscript. And that's really based on the type of article that they're submitting for publication. So it could be a case study, a review article, original research, et cetera. And then they'll be asked to enter information about the submission. So, for instance, an abstract, the title, any author affiliations. And then they're going to be asked to actually load the manuscript onto the site. Once that's done, their submission is assigned to a member of our journal's editorial board for a sort of initial review. Make sure that it's a good fit for the journal's mission on integrated primary care, and then also that it meets the formatting requirements. And after that, the manuscript's sent out to at least 2 peer reviewers. And these are experts in the field or in the specific topic of that manuscript. And authors should expect to obtain feedback and a decision within 4 to 6 weeks. Really, at any time, authors can log on to the JIPC website and track where the manuscript is in that review process. And of course, they can also contact me or Dr. DiTomasso if they have questions. And in terms of the articles that we're seeking right now, I think we'd welcome any submission that would be of interest to professionals working in integrated primary care or those educating the future integrated care workforce. So this could be a case study or a systematic review, best practices or a program evaluation, or even original research. But again, the topic really just needs to have a multidisciplinary focus in the context of primary care. So it could be about a behavioral health initiative or relate to pharmacy or physical therapy or nursing, anything related to primary care. And I would say the topics of very high interest to JIPC are randomized controlled trials of interventions within primary care, particularly for the treatment of chronic health conditions, the kinds of things that primary care providers see day in and day out. And also evaluations of multidisciplinary programs that promote better health, but also greater treatment engagement in traditionally underserved or hard to reach patient groups.
Bob, so who's the audience for this journal?
The disciplines covered in JIPC span primary care, internal medicine, family medicine, nursing, behavioral health, pharmacy, pediatrics, health profession, education, healthcare administration, social work, primary care professionals at graduate schools, academic medical centers, public health institutes, health systems, clinics, private practices, community organizations. Generally, people who would be interested in the content of the journal constitute the audience, academicians and clinicians dedicated to training students in this important critical area. Why, may you ask? Well, we know that good health is in large part, genetics aside, rooted in the thoughts, attitudes, beliefs, assumptions, and behaviors of patients. And we also know there's a high incidence of mental health problems manifested in primary care because physical problems mimic psychological problems mimic physical problems. So you need that kind of coordination. What we've seen is anyone interested in patient-centered care, empirically supported treatments, coordination of care, collaborative care, communication. We know that the literature is supporting a decrease in ER visits, hospitalizations, decreased costs, increase in patient satisfaction, provider satisfaction. So we know that it's really a great fit for what clinicians do who may have been operating in vacuums. We're trying to bring people together to say, this is going to improve the healthcare system. So anyone who has an interest in any of those areas would be people who might be interested in our journal.
I don't think you left anybody out, Bob. So
I could probably come up with a couple more.
No, it's okay. I think we got it covered. So Michelle, so what are the benefits of being published in this journal?
Yeah, well, objectives of JIPC are really to guide and inform the multidisciplinary clinical care of primary care patients. But another objective of JIPC is to include at least one graduate student author in each issue. So one of the benefits for students in particular is to be published while they're in graduate school, which really strengthens applications to internships, residency programs, and fellowships. And we've only had one issue published so far, but I think one benefit of being published is that people are actually reading it. So in the first week or two, we had over 175 full text downloads. So one benefit is that it seems to be of interest and it's being read. And also, our value as clinician scholars is to make the evidence base available to whomever wants it. In other words, scientific articles should be free. They should not cost money to read. So open access aligns well with this value, and the journal is available to anyone who creates a login. And we have to thank our librarian colleagues for helping us get this journal up and running through a system that allows for open access. They were really instrumental in getting JIPC off the ground and in the way that we really hoped to run the journal. So thank you, library colleagues. Also, unlike many other journals, in addition to not having to pay to read the articles, submission to the journal for authors is also free. It's completely free. So many peer-reviewed publications can charge authors thousands for providing open access to their publications, but JIPC is free for authors to submit. And again, free for anybody to read.
So, as usual, somebody always has questions for me when we do our podcast.
Yes, I'm going to turn the spotlight on you now.
Okay.
So I'll start. So as an institution, PCOM seeks to be a leader in training students to work in interprofessional settings. What are we doing to advance that effort, and why is this so important?
Well, we've tried to be a leader in interprofessional education, and we've been doing it in terms of, joint lectures, programs together. But from my perspective, until we do more of, and we're doing some of it now, we actually have all the members of the interdisciplinary team training clinically together, taking care of actual patients in the clinical setting. To me, that's the gold standard. And that's where I think we have a tremendous opportunity for research. And that's where I think we could really be a leader in integrated primary care. And I think that's where the journal comes in. It adds to that leadership. And I think this is a great opportunity for the osteopathic profession in general, because our profession tends to lend itself to be leaders in primary care. And I was actually formulating here, have we gotten this out to our osteopathic brethren in all the additional osteopathic medical schools to say, hey, this is open access, no charge to read, no charge to publish, no charge to submit. So I think that's something we all could follow up on.
I agree on all those points. And I was just thinking we should go to POMA and we should maybe have a table or something. Thank you.
So Jay, here's a question for you. More and more, we're seeing clinical clerkships, practicum internship experiences emphasize the importance of students gaining basic research experience and developing an understanding of the methodologies of research. If I heard it once from you, I've heard it 100 times. Follow the evidence. That's a famous J. Feldstein quote. Why do you think research experiences are so crucial and critical for our students to participate in?
Well, one, I think Michelle touched on this, and Bob, I'm sure, you would agree. It advances the science. I mean, at the end of the day, we are a scientific entity. We can talk about whole person, we can talk about holistic care, the integration of behavioral health and physical health, but we need to prove it, and we need to have the evidence to prove it. And that's where I really think from clinical integration and primary care delivery, we can be the leaders in proving what works and what doesn't, what's anecdotal and what's evidence-based. So I think that's the primary driver. And secondary, and Michelle, you alluded to this, it's a very competitive world out there for graduate students, whether they be medical students, psychology students, whatever the profession is, for postdoctoral education. And i.e. for DOs, it's residencies, for psychologists, it's postdoc work. And this is a competitive world, and they need to be competitive. And publishing papers in the research world adds to their portfolio and their competitiveness. And we want our students to be successful. Yeah. So it's all part and parcel, of the holistic application process for postgraduate work for all of our students.
Very good.
Well, I'd like to thank both of you for being with me today, Dr. DiTomasso and Dr. Lent. I'm excited to see how the Journal of Integrated Primary Care, JIPC, goes, and to positively impact our students and beyond. And most importantly, at the end of the day, our patients. We're here to educate the healthcare providers of the future. And the reason we want to do that is we want to take the best possible care of our patients. Before we wrap up, I'm excited to introduce a new segment to the podcast called Med Student Mailbag, where we take a question from the students. These questions were submitted by students from all campuses. Let's see what they've got for me this week. Here's one. Looking back at your career highlights, what's one thing you could have done differently? Well, when I look back on my residency and my career track in emergency medicine, I loved my emergency medicine residency. I love my time in the ER. I would not do that differently, but in retrospect, I would do a dual residency in EM. I would either do an EM-IM, EMFP, or EM-PEDS, because I think one of the challenges in emergency medicine has always been a high burnout rate. And doing a dual residency gives you great options if you hit that point in your career where after 10 to 15 years, you still want to practice clinical medicine, but you want to slow down. You want to get out of that emergency medicine environment and want to do a practice with continued follow-up care. So I think if I was going to do one thing differently in retrospect, I would have done a joint EM-IM or FP-PEDS residency. I hope that's helpful for all of you out there. Well, that's all for today. I look forward to answering more student questions in the future. Visit our social media channels for more info on submitting your questions. I'm Dr. Jay Feldstein, and this has been PCOM Perspectives. You can listen to PCOM Perspectives on Spotify or wherever you get your podcasts. Until our next episode, remember, as you navigate the fascinating worlds of medicine and higher education, shifting your outlook can be the key to unlocking new insights and better patient care. Stay curious, stay open, and keep a healthy perspective.